What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
What's the best place in the house to hide from ghosts? The living room.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve. My little pal, Dr. Scott, the traditional Chinese medical practitioner, gives me street cred with wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And this is a shout-out to Amanda. No, cold temperature doesn't cause colds. Viruses and bacteria cause colds and pneumonia, not cold temperature. But you may be more susceptible to it during cold weather. So a little fun fact, keep people listening to the intro. This is a show for people who never listened to a medical show on the radio or the internet. I guess it was Amy that asked that. If you have a question you're embarrassed to take to a regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Don't forget stuff.drsteve.com, stuff.drsteve.com for all your shopping needs. You got a guitar player in your family, go to stuff.drsteve.com, scroll down, buy them a Rode robotic guitar tuner. Do it now. If you don't want to go to stuff.drsteve.com, go to Rode, ROADIE.drsteve.com and buy them one today. It's the greatest gift you'll ever give them. And it doesn't cost you an arm and a leg. And check out Dr. Scott's website at simplyherbals.net. And check us out at patreon.com/weirdmedicine. That's Tacey and me and some celebrities sometimes. We're supposed to have Gino Bisconti soon. Joe List is on the list. Kevin Brennan's on the list. I'd like to have Rich and Bonnie. Sometime I might have to have them on separately for lots of different reasons. But the main one, so I don't lose control of the show, as I did the last time we did the three of us a show together. Go back and listen to their episode called Personality Test, I think it's called, or Compatibility Test, I think it was. And I did a Myers-Briggs personality assessment on the two of them.
Oh, goodness.
And it was interesting. One of them was ISTJ and the other one was ISTP. So they were exactly the same, except for the last letter. But it made all the difference. And what that meant was if Bonnie is, getting ready for a trip, the two of them are getting ready for a trip, and ISTP will just throw stuff in there, just throw stuff in the suitcase and then go, hey, if we get there and I forgot something, I'll buy it when I get there. Whereas the ISTJ has all their little packing cubes, and they've got the X number of underwear and all this stuff all in a row, all perfect. And the ISTJ, which are the J stands for judgment and the P stands for perception, they will criticize the other one for not doing it the way they do it. And so that was very real. And but that was a fun one. It's several years ago. And at the spoiler alert, at the very end of it, I just started playing an old song called "You Have to Accentuate the Positive" to finish off because I couldn't get them to stop. I just said, "Well, let's just end it that way." So anyway, all right, very good. And then Cameo. It's time for holiday cameos. Cameo.com/weirdmedicine. I'll say, "What up to your mama?" at the holidays for a very little amount of money. And what is hilarious is I tried to get the comedian Tom Myers to do a couple for me, and he reported me to Cameo saying that I was a troll impersonating a well-known radio personality. So he thought it was some person impersonating me, trying to get him to goof on people. I was just as me trying to get him to goof on people. And his thing's $60. I bought two of them. I figured he'd be excited, for $120 to, go out and take his chick out to dinner or something. But no, he would rather just not accept the money. But anyway, okay, Tom, it was actually me, and I'm sorry that that didn't work out. Don't forget Dr. Scott's website. It's simplyherbals.net. That's simplyherbals.net. Did you bring that little bottle up with you?
Yes.
You did? So a friend of mine turned me on to this stuff, and this is not an advertisement for them. It is, I can't even read the damn name. Okay, Magic Mind it's called. And this is an herbal supplement that you can buy, and this stuff was fabulously expensive. And do you still have the ingredients up there, Dr. Scott? The reason I bring it up is it says do more, stress less. Do you not have stress less trademarked?
Well, no.
Okay,
no.
so
but I'm all about doing more.
You got in trouble with one of the things that you said, right?
Yeah, some.
Was it stress less or was it fatigue?
It was stress less. Yeah, some doofus in Atlanta said he had it trademarked and of course,
well, allegedly a doofus.
No, he's a doofus. I said it. I heard it. If he heard it, I hope he hears it.
Okay.
But no, they're and hell, there's 70 different stressless. There's a stressless sleeper, a stressless recliner, and
yeah, I guess it is context driven. My understanding is trademark. You can't trademark something blanket. It has to be with the context,
right?
So you can't say, "Well, I have this thing called stressless, and no one else can use it for anything else."
Yeah, no one else can ever use that term. Yeah, intellectual property and trademarking and all that stuff, patent stuff, it's all pretty tricky.
Yeah.
Yeah, I mean, that's why those guys that do it for a living, I think, make a pretty good chunk of change doing it. For
yeah, well, I'm going to check out this
too.
Magic Mind stuff, but I think maybe you ought to amp up your marketing a little bit.
I can.
I mean,
think
for
about
real.
doing more marketing on the Weird Medicine Show. It's my favorite
on the podcast part, right?
It's my favorite show.
The most famous show on the.
Evidently, it's the second most famous show in the world.
Right, with the Cardiff Electric podcast being number one. All right. Well, check out Dr. Scott at simplyherbals.net, simplyherbals.net. I see no one has put a copyright strike on you or a trademark strike on you for fatigue reprieve.
No. How bizarre is that?
It's not as cool of a name.
No, but it rhymes.
There you go.
It makes it sound good.
All right. Yes, it does.
Hey, we've got a great bunch of folks with us today.
Well, that's because we're recording on Saturday now. So if you want to hang out with us while we record this, early termination of a pregnancy of a show, check us out at around 1 o'clock on Saturdays on YouTube. Just, go to our YouTube channel and subscribe and like and turn on the notifications. And when we go live, you can come in and hang out with us. We've got a good group in there. So, and they have to listen to our shite music at the end of the show and all that kind of stuff. So, yeah, it's fun. But it's fun, though. All right.
Oh, yeah, it's a lot of fun.
Well, very good.
Number one thing, don't take advice from some asshole on the radio.
Boy, ain't that the truth. So I've got a couple of voicemails here, and you've got some topics and stuff, too.
Yeah, we've got a couple.
Do I hear? Yeah, that's what I heard. And Tacey's in Las Vegas, so I don't feel sorry for her.
No.
And, yep.
She's probably still in bed right now as we speak.
No, I just talked to her. Yeah, they got up. They went and saw Ron White last night.
Oh, my gosh.
And apparently he is retiring. And, but yeah, it made me kind of sad because Vic Henley was a friend of ours.
Mm-hmm.
And, there's a cadre of people that say Vic Henley wasn't funny. I disagree. Whether you liked him on the Opie radio show or not, that's here nor there.
Mm-hmm.
I saw him absolutely destroy an audience of 300 people at Allendale, at one of the Allendale comedy events that we put on.
Mm-hmm.
And it was in a barn, which was apropos.
Yes.
And, it was a bunch of people from Upper East Tennessee. So it was his audience, but he destroyed in that audience. And he was such a nice guy, too. Vic Henley was a very nice person. He got stuck in Atlanta, and apparently he couldn't upgrade his ticket because I had bought his ticket with miles, and there were some restrictions and stuff.
No.
And it's like, dude, I'll fix it, whatever you want. He missed 2 gigs. We would have them come in on Thursday so they could do their gigs on Friday and Saturday. He missed all his Friday and Saturday gigs.
Oh, goodness.
I sent him a check for, I can't remember, $750,000 just to, make up for some of that. I have no idea how much he was making in New York at the time. And he sent me back an email, you son of a bitch, I'm not taking your money. And he gave it to, some veterans charity, which I thought was really cool. I mean, he was a cool guy, really nice. And it was so we all figured Ron White would be the first to go, and he's still going at it. And, poor old Vic is no longer with us. So, but anyway. But yeah, a good guy, still greatly missed. And he's well regarded in Upper East Tennessee. You know who else is Tim Dillon. They loved him here. Mm-hmm. We got Tim back before he was Tim Dillon. He was, nobody'd ever heard of him. We got him for $1,500 plus expenses, plus travel and expenses. And he totally destroyed that audience too. So, we've got a good population for comedy here because they really are just sort of starved for comedy, to be honest with you.
Yeah, I think we only have 1 or 2 local.
Well, we never
joints,
we didn't have any.
Yeah, I know we had none for years, and
that's why we started etncomedy.com, and we did a few sort of larger events, mainly just as a proof of concept. And now we've got a couple of comedy clubs. They're all in Bristol, right around or Bristol, Virginia, where the casino is, but still, it's something.
So Virginia now has a casino and marijuana.
Yeah.
And we got nothing.
Nope. Nope.
Tennessee's a little slow on the draw.
We got whiskey.
We do have some Tennessee whiskey.
And
that's a good thing.
We got corn squeezing, don't you know?
Hey, by the way, we've got to stop the show for 2 seconds. It is Amy's birthday.
Amy. Oh, Amy.
Talk like a hick to you.
Okay, let's see here.
So happy birthday, Amy.
Let me here.
You get nothing. You lose.
So there you go. Happy birthday.
Happy birthday.
Uh-oh, wrong one.
Wrong one.
No. Anyway, all right. Happy birthday to Amy in the waiting room. All right. What else we got? You want to do your... Well, let's do some of these questions, and then we'll do that.
That'd be great.
Here we go. All right. Let's see what we got here. This is on tolerance.
Hey, Dr. Steve.
Yeah.
Randy from Austin.
Hey.
I had a very weird question to ask, of course.
Cool.
Basically, I've been having a theory that I believe that if you are constantly taking medicine, that the effectiveness of medicine tends to wear off. Now, personally, if I don't have to take any kind of medication whatsoever, I try not to, with, of course, with the occasional, flu, cold, or sore back, a painkiller here, NyQuil, Dayquil here and there and such. But I wanted to know, if someone is constantly taking medicine, does the effect of medicine loses its potentness over time? Or is it just that you're kind of getting
I think you
more
made up
used
a word
to
there, buddy, but
the
I know
side
what you
effects,
meant.
or vice versa? Or
Yeah.
That's basically what the question is. Does taking medicine constantly over time loses its potency in the human body? Thank you.
Good question.
Yeah, and it is a good question.
Great question,
And the answer is it depends. It depends on the medication. So there is a thing called tachyphylaxis. Tachyphylaxis is where a medication rapidly loses its effectiveness in the, after continued use. There's also tolerance. So if I give someone an opioid, let's say I give them 5 milligrams of oxycodone every 4 hours for their pain, after some amount of time, they may require 10 milligrams to get the same effect, and then 30 milligrams, and then 80 milligrams, et cetera, and that's called tolerance. And there is a thing called upregulation, too, and that may be related to tolerance, where if I block a receptor that the body uses, for example, an acetylcholinesterase receptor, if I block that receptor, the body will go, well, wait a minute, I need those receptors, so it'll make new ones. Mm-hmm. And then the medication becomes less effective because now you've got all these receptors. Maybe you start off with 100, let's say, multiply that times, 1 million. Mm-hmm. And now you've got 1,000 of them. So you need that much more medication to cover those receptors to do the thing that you're trying to do.
Right.
There's desensitization, too.
Mm-hmm. Sure.
That's where there's a biological response to a drug diminishes when it's given continuously or repeatedly. And it may be possible to get the response back by either increasing the dose of the drug or in some cases the tissues become completely refractory to that effect. So, and then, as I said, tachyphylaxis is used to describe desensitization that occurs very rapidly, sometimes even with the initial dose. So an example of a drug like that could be an H2 blocker.
Okay.
Like famotidine.
Right.
Those are felt to have, in some people, tachyphylaxis, in that when you take them to suppress acid in the stomach, they'll work really well the first couple of times, then they drop off. Mm-hmm. But I can think of counterexamples.
Yeah.
Marijuana.
Yeah.
Most people will tell you that the first time they tried pot, it didn't do anything. It was the second or third time, all of a sudden, it kicked their ass. Now, I don't know if that's a myth or not, but that's a case where you become sensitized to something. Mm-hmm. You got any other examples?
Well, I was thinking another example would be something like testosterone, and even some thyroid medications. If you take them for long enough, your body stops producing. Like testosterone, for sure.
Yes.
You take testosterone long enough as a supplement.
Oh, that's a good one.
And your body says, wait a minute, you've got plenty of it. Well, let's just stop making testosterone. So you have to continue to take it. So that's a whole different animal.
Opposite of upregulation.
Yep,
Upregulation, that's actually downregulation of the thing that the body was making. Mm-hmm. So, yeah, you would need more up to a point.
Yeah.
There is a phenomenon called where you deplete the chemicals that are necessary for the pharmacological actions of the drug. So let's say you have a certain number of neurotransmitters, and then you deplete those. And once you deplete those, then you can keep going up and up and up on the drug, and it won't work anymore. Mm-hmm. I'm thinking of maybe capsaicin. Okay. Would be one where that is the molecule that causes red peppers to be hot. Mm-hmm. And if you put that on the skin, it'll burn the first few times. But if you keep putting it on, it won't burn anymore. And as a matter of fact, if you had pain in that area where you're putting it, where you're putting the capsaicin on, it'll actually stop hurting.
Yep. In a lot of cases.
So you can harness this effect to your benefit. Go ahead.
Well, which is just completely counterintuitive, because sometimes we'll tell people to put it on something that hurts, and why would you want to put something that burns on something that hurts?
Because you're depleting that neurotransmitter that sends the pain fiber to the brain.
Yeah, it's counterintuitive, but it does work.
Yeah.
It's kind of crazy.
So I'm looking here at an article to see if there are any things. Drug resistance is a term that we reserve to describe the loss of effectiveness of, say, of an antibiotic, but that's because the organisms actually figure out a way around it. Penicillin used to kill almost all bacteria that it came in contact with, and now it kills very few. And that's because the bacteria have learned, when you get one that figures out, hey, I can phosphorylate one, part of this molecule, or I can close this receptor, or I can do, I can change the way that I metabolize, certain aspects of my environment, and now the stupid antibiotic just bounces off of me. These fucking things will send out little pieces of DNA so that other bacteria can pick it up and learn how to become resistant to it. And also, just think of it this way. If you, let's say you have a group of bacteria and there's just a billion of them. You got a billion of them. That's a very small number for a bunch of bacteria, but you got a billion bacteria, and 100 of them are resistant to a drug. Okay. And you throw the drug on there, you kill all but 100, right? So it seemed, to us, they're all gone. Yeah. But that 100 now can reproduce at will because there's no competition for them anymore. Yeah. And now they'll reproduce like crazy. And now when you get a billion of those bacteria back, they'll all be resistant to the drug. Yeah. This happens with cancer chemotherapy too. Small cell lung cancer, good example of that, where you kill it the first time with your chemotherapy, and then when it comes back, it's the cells that you didn't kill the first time that come back, and now they're resistant to what you threw at them because they didn't die the first time.
Yeah, isn't like CLL, like chronic lymphocytic leukemia, like that, or lymphoma? One of those two.
Lymphomas can be like
lymphomas. That's what it is. Yeah. I thought
they'll go away really fast.
They can go away, but then they tend to come back and.
Well, sometimes with lymphomas, sometimes you can just kill everything. Okay. They've gotten better and better at treating lymphoma. Cool. But there's two kinds of cancer that you can treat in the ICU. Most of the time, they want you to be able to walk into the chemotherapy suite, because when you give someone chemotherapy, it takes someone that's at a high level of functioning and will drop their level of functioning down. So if you bring somebody that's in a low level of functioning and drop that down, you can do them in. So they'll require usually a certain level of functioning before they can just give you the high potency chemotherapy agents. But small cell lung cancer and lymphoma are exceptions to that, because you can sometimes treat those people with one dose of chemotherapy and then it will just dissolve. And now you have to keep treating them to try to get all the cells that you can possibly get and keep it away as long as you can. But they will do that. Now, do I recommend someone on the ventilator being treated with chemotherapy? No, I don't recommend it, but it can be done. That's the one time you can do it. And as a matter of fact, they will kill so many cancer cells at once that the body has a hard time processing it. It can cause gout. Oh, good. And it can cause a thing called tumor lysis syndrome, where you've killed so much dead, tissue, human tissue in the human body, that the body can't handle it.
Wow. Yeah, how do you get rid of that?
Well, they end up in the hospital. A lot of times you give them fluids to flush out their kidneys.
That makes sense.
That kind of stuff. You give them medication to prevent gout crystals from forming and stuff.
Don't use the G word in my presence, please.
But anyway, so now back to his question, there are other drugs that you can just take on and on and on forever, and they do just fine.
Example, like a blood pressure medication, I would think, for the most part.
Yeah.
Those tend to be pretty stable over time.
Yeah, and if your blood pressure does tend to increase over time, it's usually not because the blood pressure medicine is failing.
Right.
It's because your genetic predisposition to high blood pressure is progressing.
Yeah. Or there's some other things that need to be looked into a little deeper.
But it's a dynamic process, and there are reasons for all of these things. Yep. Why do people get more and more resistant to insulin? It's because insulin half the time is the problem. And when you get these spikes of insulin, the blood sugar drops low, and the body really hates low blood sugar situation, so it'll start to dial down the sensitivity of the of the body's response to insulin. Mm-hmm. It's just like if someone's shouting in your ear, you're going to turn down your hearing aid. Mm-hmm. And then you keep turning it down as they get louder and louder because you can't hear them. Mm. And you keep turning it down and they keep yelling louder, and then eventually you can't hear anything, no matter how loud they shout. And just think of insulin as being the person that's shouting, and the body's response to insulin as being the hearing aid.
My great-grandmother you could tell when she was tired of listening to you.
She just reach up.
Yeah, she's reach it up, put her shirt pocket. Hey, I've got a quick.
Damn kids!
Shut up, kids! I've got a quick question from Bonafide, Lloyd Bonafide. So he had a coworker last week had something grow on the ball of her foot. She thought it was a wart. Went to urgent care. Turned out to be an infection. They drained it.
Okay.
And so the question was, how did she get an infection in the ball of her foot? There were no cuts or anything.
Right.
But here's the clue.
Diabetes.
She wore some weird shoes.
Oh yeah, what'd she wear?
I don't know. He just said she wore some different shoes. So I've got to guess.
Well, okay. Well, yeah, go because mine is just really a guess. So.
Yeah. Well, I was going to say, what I think she probably did if she wore some weird shoes. Put some weird pressure on her foot. She may have developed like a bursitis.
Yeah, I was thinking of a callus.
Yeah. Well, if it's a callus, they might not have drained it though. But if it was a pretty nasty bursitis, they might have drained it.
Oh, I see what you're
saying. See what I'm saying?
Yeah.
Like if you fall and hit your
elbow,
olecranon.
Oh God, your olecranon. Yes.
Your olecranon burst, but that happens a lot. We see that in a lot in elbows.
Yeah.
Sometimes a wrist, a lot of joints when there's trauma to that joint. And that might have been what happened to her foot.
Huh.
That's my guess. No, we didn't see it obviously, but
yeah.
But that would make sense to me, especially if it was that acute. You can get traumas to the bursa and the knee, and get like what we call a pre-patellar bursitis.
Yep,
it can be due to a trauma, and they'll actually draw that fluid out of there.
That'd be in the knee, right?
Yep.
Yeah, toe joints do have bursas, and they can get bursitis, so that may be what it was.
Yeah, makes sense to me.
The ball of the foot. Yeah, it could be. Could be.
Yeah.
I a lot of times would see people who were diabetic and had a big callus on the bottom of their foot, and that would become infected. And you go, well, how did this happen? There wasn't a cut, not that we knew of.
That you could see, right. And there may have been something stuck in there that they just didn't see, and they just drained us. So.
Yeah.
But at least there's an alternate answer for you there.
Yeah, absolutely. I'm looking here. How do you treat bursitis in the big toe? Rest, ice, elevation, stretching. Yeah. Wearing insoles to your footwear.
No, that's a terrible idea. Put on Chacos, brother. Chacos will do it.
What the hell is a Chaco?
A Chaco will take the pressure off the toes and arch of the foot.
How do you spell that?
Just like a taco, but with a CH. Those are the shoes I wear. Best shoes ever.
Oh, okay. Those are those negative heel things that you're talking about. How in the hell is that going to help a bursitis in your toe?
Well, it takes most of the load off your toes, especially at rest.
Oh, really?
When you're walking, it's normal, but at rest, it takes all the load off your toes.
Huh. Okay.
Yeah.
Well,
there you go.
So says Dr. Scott.
There you go. Science-based.
Is it?
Here. No, it's not. Of course it's not.
Jesus. All right.
Hi, guys and girls.
Hello.
Just wondering, 39 years ago, I had to take a blood test to get a marriage license. And I don't know if they still do that or not. But what was it they were looking for, and what would have showed up that they would have said, sorry, you can't get married? Just curious. Thanks.
Yeah, I know exactly what they were looking for. They were looking for syphilis.
Oh,
that is absolutely true. Now, almost every state in the United States has dropped any blood test requirements before getting married. There is a partial exception, which is New York, which requires that people of African and Hispanic descent get blood tests for sickle cell anemia. Now, that law allows religious exemptions, and apparently the results won't affect your ability to get married. So you have to have the test, but you can't. But you can still get married. And so states sometimes require applicants read a brochure that includes information about inherited and sexually transmitted diseases, such as HIV, and how to get tests for those diseases. So there you go. So that's what that was for the most part. It was back in the day they were looking for syphilis just to make sure that you weren't infecting somebody. Because syphilis was a horrendous disease before we developed treatment for it.
Oh, gosh, yeah.
And one of the main reasons for monogamy and for not having intercourse before marriage.
Well, there you go. Yeah.
Because syphilis was bad. It was it's related to Lyme disease in the sense that they're both spirochetes. The molecule is sort of a twisty-turny looking thing.
Yeah.
All right, the molecule, the bacterium. And they have three phases. Think of Lyme disease. You have a rash, and then you have a latent phase where it goes away, and then you have this tertiary phase where it comes back and F's you up. Pretty good. In the case of Lyme disease, it can affect the heart and the joints and stuff.
No.
Now, with syphilis, you have a rash, you have a chancre that divides and divides again. It's usually painless. And then you would have a latent phase, and then the tertiary phase that can affect the cartilage of the face, so your face just kind of falls off. Or it would invade the brain and cause neurosyphilis and make you crazy.
Right on.
So there you go. So, but that's what they were looking for, and that is no longer the case. I think I remember when I got married the first time, I had to get a physical exam.
Okay.
And I remember the guy checked. I'm 19 or 20 something years old, and he's doing a prostate exam on me. It's like, was this really necessary?
Oh, geez.
But, yeah, he thought it was. All right. How about this one?
Dr. Steve, Dr. Scott.
What's up?
Hey, can excessive sneezing from allergies or coughing from something too much cause any minor brain damage? Love you guys. Love the show.
Well, we love you back.
Yeah, love you too, man. Yeah. No HMO. Only private insurance. Oh, that's a joke. Okay, sorry.
Oh, terrible. Thank you.
Okay, so it's not true that your heart stops beating when you sneeze, but it is rare that if you go on the internet, it'll say, no, you cannot die from a sneeze. You cannot die from a sneeze. People have died from sneezing, but it is extremely rare. I'm looking in the UK. Here's a teenager sneezes to death.
Ooh. Mother's
despair after 17-year-old son suffers a brain hemorrhage following a sneezing fit. And this was the example I was going to give, so it's very sad to see this, but glad that that we can talk about this a little bit. If you have an aneurysm in your brain and you sneeze, it is possible that thing could cut loose, but this is not a reason not to sneeze or not to hold your sneezes in, because it's unbelievably rare for this to happen. But this is it's a tragic story. A teenager collapsed and died from a brain hemorrhage after having a sneezing fit. The kid had a seizure at his home in Stockton-on-Tees after sneezing 6 times in quick succession. And I'm going to assume that he had a congenital abnormality in the brain. I don't. This is a very long article, but I'm going to assume that. So there are some. If you have a predisposition for an aneurysm, and you sneeze and it triggers it, yeah. But if it was on the borderline like that, it was going to happen anyway, no matter what you did. So the main thing is if you have symptoms of a neurologic nature, particularly involving the face, where you feel, all of a sudden half of my face has gone numb, or if you have the worst thunderclap headache you've ever had in your life, don't ignore that. Go get it checked.
Yes.
And most of the time, it'll still be nothing. Mm-hmm. But every once in a while, they'll pick up on something that can save your life. This is one of those things where Western medicine it can really help you.
Oh gosh, yeah, far superior. Superior. Hey, Amanda's got a good question. What about like holding your nose or pinching off a sneeze? Good or bad?
Yeah, I'm not a fan of that. Just let it. Yeah, it's there. It's
to protect you.
There is a sneeze. Right. That's right. There's a sneeze reflex for a reason, and people who hold it are, they're preventing that reason, which is there's some antigen in your nose, and the body's trying to just blow it out forcefully.
Yeah.
And, sneezing may help prevent you from getting ill by expelling the things that are getting into your nose, helps reset the settings of your nose back to normal. But when you're speaking to someone else, you kind of want to hold in the sneeze or whatever, but you can just turn sideways and put your nose in your elbow. Most people are aware that sneezing is a thing, and they're not going to be horrified by it. So there was a 2016 study where scientists measured a pressure level of 1 pound force per square inch in the windpipe of a woman who was sneezing. And when they were exhaling hard during strenuous activity, it was only like 0.03 psi. So holding in the sneeze greatly increases the pressure inside the respiratory system to about 5 to 24 times that caused by the sneeze itself. And you just never know.
No.
So, again, if you've got a really robust, healthy body, it's probably not hurting anything. But if there's anything in there that's slightly on the borderline, then it could push you over the edge. So, and I've actually seen somebody rupture their eardrum holding in a sneeze.
Oh gosh, I've ruptured my eardrum before, and that hurts. That's some painful shit, man.
Here's one. According to experts, the pressure caused by holding in a sneeze can potentially lead to the rupturing of a brain aneurysm. Well, we just talked about the sneeze actually doing that. And then, there's a life-threatening injury. I'm not even going to read that one because that one's bullshit. Doctors have found one case of a person rupturing the back of their throat by holding in a sneeze. So it's one case out of billions of people. Yeah. So I'm not too worried about that.
No.
But anyway, I think the risk of holding in a sneeze is pretty low, just as the risk of sneezing is really low. But what would be the point of doing it? When we have mechanisms now for sneezing and coughing in public that are acceptable.
But the only people you ever see holding in their sneezes are females.
Yeah.
Guys I think it's because they're delicate and they're sweet and they're
Well, they hold in their
soft
flatus too, and guys just kind of let it rip. Or try to make a silent but deadly one,
Yes, I believe there's some gender inequities there, I would believe. Let it rip.
I've been in my office before where I've just, I've drunk too much kombucha or something, and I've got gas and...
You're drinking kombucha now, stop it.
Yeah, I know.
That's enough.
It just really doesn't gas me up, but it's something, whatever it is. And, you let out this silent, but, really horrendously smelly flatus. And then you're just praying nobody comes in there. And then here comes my program coordinator. Can you sign these things? It's like, yeah, give them to me. I'll bring them to you. Get the fuck out of here.
I love it. I love it.
If you're sneezing a lot, there's something in your nose that's irritating it. you get you a Navage, or just get some Simply Saline, or some Dr. Scott Simply Herbal's nasal spray.
That's right.
And get that nose cleaned out.
You can get the original or the CBD.
There you go.
Infused.
Okay. Yes, you can. It's simplyherbals.net. But you can spray this stuff up there, let it sit there for a minute, and then just blow it back out again. Yeah. A lot of times that'll take care of it. So, all right.
Yeah.
Okay. Excellent question.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Sergeant and Mr. Smith, you're gonna love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
All right.
Hey, Dr. Steve, it's Mike from New York.
Hey, Mike.
I have a blockages in my heart. On the left side, the artery, I guess, is 100% blocked.
Oh.
Center 75 and the right 35%.
Goodness.
Once in a while, I get a little discomfort in my chest, but it's always on the right side of my chest, farthest away from the blockages. Never much, thank God. But is there a medical reason why it's on the opposite side of the chest where I feel a little discomfort at times, or what's the deal? Thanks a lot. Have a good day.
Yeah. Well, so Mike's got a bunch of blockages in his heart.
Pretty serious stuff.
But all of the discomfort he has on the right side of his chest, you always hear about pain being on the left side of your chest. So when you have heart pain.
Right.
Now, angina or angina can just, mask itself as lots of things. Mm-hmm. I've told the story about the guy when I was in medical school that died because when he came in, he said he had a sore throat.
Oh, gosh.
What he was really trying to describe to them was that he was having left-sided chest pain that radiated to his neck, or maybe he just had it in his neck. When my dad had angina, he ignored it because it was just shoulder pain. And he was on my brother, who was his doctor, put him on a treadmill. And when the treadmill started showing issues of decreased blood flow to the heart, my brother said, "Are you having any symptoms?" He said, "No, just my shoulder's hurting." And it turned out that was how angina was experienced by him. So this whole textbook thing of, people having a heart attack have sweating, palpitations, nausea, left-sided chest pain that radiates to the left arm. That's textbook presentation. A lot of people do present that way, but there's a whole bunch of people that don't. So, but stuff on the right side of the chest is a little bit weird for angina. That can be acid reflux. It can be musculoskeletal stuff in the right side of the chest. It's the question is, does it come on with activity and then go away with rest? And if it does, then that's the real hallmark for angina or heart pain. Is that when you're running up 3 flights of stairs, does it come on? And then after you've calmed down a little bit, does it go away? And if that's reproducible, that may be a sign that your heart isn't getting enough blood and therefore time to get checked again. But with that many stents and blockages, I'm assuming Mike is being seen frequently by his cardiologist. So,
yeah, I would think so.
Yeah, I hope so anyway. You got anything on that one?
Maybe he's got, what is it?
Situs inversus.
Situs inversus, yeah.
Surely to God they would know that.
His heart's on the wrong side, or flipped over.
Yeah, there are people.
Situs inversus, yeah.
That have.
Is it situs inversus or situs?
Situs.
Okay, situs, okay. Yeah.
Yeah. Situs, probably.
Situs
but
inversus.
They say
yeah.
situs.
That's what I was thinking. Rare. But, the other thing is.
Well, let's tell people what that is. That is a defect in the cells that are embryologically going to form the organs where they don't migrate the way they're supposed to, and they will end up having the heart on the right side of the body and the spleen on the right side of the body and all kinds of stuff. The liver's on the left. It's crazy.
Yeah.
Can be if it's situs inversus universalis or whatever. The complete reversal. There are some people who have the speech part of their brain on the right side rather than on the left. Most people, if you have a stroke on the left lateral side of your brain, you'll have trouble speaking. You may have a thing called Broca's aphasia, where you have trouble getting words out, or it's like a constant word search. Like times when you've heard me trying to think of the correct word to say, those people, they never get out of that loop. Or there's a Wernicke's aphasia where they don't understand anything either and can't process words. That's because the language section is all over, right above and just a little bit in front of the left ear. But there are some people where it's the opposite, and they have a stroke over there and they're totally fine, but then they end up having a stroke on the right side. Now they can't speak. So, yeah, they're crazy.
It really is.
Anyway, yeah. So there, I guess that's that. Let's do this one.
Hi, Dr. Steve. This is Karen from Wisconsin.
Hey, Karen.
Okay, about 3 months ago, I had this headache that if I could have chopped my head off, I would have.
Okay.
That went away the next day, but since then I've had a cough. And my doctor listened to my lungs, and my lungs are fine. Apparently I don't have COVID, even though I got the jab late last year. Now, when I cough, I don't cough up mucus or anything. And I breathe so loud when I'm breathing that my dog looks at me funny. And my doctor gave me prednisone and a steroid inhaler, and nothing works. She doesn't know what else she can do. She won't order like an X-ray or anything because apparently I have to do that, and if I ask for it, then I have to pay for it. So I don't know what kind of fuckery the
Oh my God, that sounds like Catch 22.
Mm-hmm.
Remember in Catch 22, the Yossarian, the pilot, or I guess he was the bombardier, but he wanted to get out of flying bombing missions in World War II. I said, all I got to do is, is say you're crazy. But then if you said you were crazy, you couldn't be crazy. So then they couldn't let you out. And that was Catch-22. And then, of course, Catch-22 became everything.
Yes.
In that universe.
So that was originally a movie.
No, it was originally a book.
Okay.
But the movie by Mike Nichols is awesome. The TV show, not so much. They really didn't get the humor in the TV show.
I never saw it.
It was, it was on one of the cable networks, and I really was disappointed in it. It was a satire, and the Mike Nichols movie is brilliant. But
anyway, let's see. I'm normally healthy, but I did have pneumonia and bronchitis, but that was way back, like 10 plus years ago.
Yeah.
So I still have the cough. I don't have it that often, but I mean, it's every day.
Yeah.
So, and I'm wheezing most of the time.
Okay.
But I'm not dying. I don't feel like it.
Yeah, right.
But it just feels like it's heavy in my...
I'm going to discount the headache part.
Yeah.
And I'll tell you why. Because there are coughs that cause headache, and sometimes that can be a sign of leakage of cerebrospinal fluid in the brain.
Yeah.
And people that get this cough, and then it'll cause headache as the increased pressure from the cough sort of forces some of the cerebrospinal fluid out. And people with chronic cerebrospinal fluid leak have all kinds of problems. So I'm going to assume that's not it, because it's really the other way around. The cough makes the headache, not the headache starting the cough.
Yep.
But I would look at the drugs that she's on.
Yep.
She's on an ACE inhibitor.
Blood pressure medicines for sure.
Blood pressure medicines can cause chronic cough.
Yeah.
Post-nasal drip can cause it. Asthma, reflux, that's a big one. Gastrointestinal reflux.
Yep.
And the x-ray for that, there's a simple x-ray for that. It'd just be a barium swallow, and where they're just looking to see if under fluoroscopy, where they turn the x-ray video camera on and see if your stomach contents are coming up into your esophagus.
Yep.
And if they're coming up far enough, that can just cause a chronic cough. And then just chronic bronchitis if you had if you had emphysema or something like that. So, or obstructive lung disease from smoking in the past. A foreign body can do it too. So, you get a foreign body lodged in your lung and it keeps trying to get rid of it. It can cause cough. So what I would recommend is that if they're not going to do an x-ray, for goodness sake, do a spirometry.
Okay.
Spirometry is where you blow into a tube, and then it will determine what your lung volumes are with inhaling and exhaling. And if it shows obstructive disease, well, then you probably have chronic bronchitis. They can treat that. There are things that they can give you for this instead of just blowing you off like this. But a chest X-ray, CT scan of the lungs, or an MRI of the lungs, that could be something. Treat post-nasal drip. Go ahead.
I was going to say post-nasal drip for sure. And the other thing is she could treat GERD just for the heck of it. And if that helps her cough, I mean, that's a pretty simple treatment, and it's not going to affect, if she does have something else going on in her lungs, it's not going to affect that at all. So she might be able to try just treating herself with some anti-reflux medication.
The thing is, if it's mechanical, decreasing the acid content in the stomach is great, but the contents still come up. So that'll improve it, but may not make it go away. But he's right. There's over-the-counter stuff for reflux.
Yeah, the only other thing I could think of is if she had a headache first, maybe she had the flu. If they checked her for COVID but didn't check her for flu, she could have had a headache from the flu and then got the upper respiratory stuff.
Yeah.
But hopefully she gets better soon.
I'm looking up something here. There's a
Kush made it.
Kush. There is a thing called bradykinin that plays a major role in dilation of microscopic vessels. And it dilates arterial cerebral vessels, contributes to that migraine pain. So she talked about migraine. The other thing is that Bradykinin is also involved in cough too, and this a bradykinin mechanism is what's blamed for the cough that is caused by ACE inhibitor, blood pressure medications, and angiotensin receptor blocker blood pressure medications. So bradykinin induces sort of sensitization of these airway sensory nerves. They cause airway smooth muscles to constrict, leading to bronchoconstriction and cough. So it is kind of interesting. Headache, bradykinin is associated with that, also associated with cough. There may be a connection there. She'll email me. I'll do some more research on this, see if we can find something. Okay? All right. Let's see here.
Hi, Dr. Steve. This is Phil from Tampa. I was calling because I had two quick questions. I hope semi-related. The first question is, in the past couple of shows, you've been talking about people who've needed procedures that have had, rods in their spine or screws or plates and screws. I'm just curious, why doesn't the body reject, I'm assuming, metal in your body? Like, it just seems weird to me that the body wouldn't see that and be like, oh, no, that's got to go, and try to do something about it. And then my second question is, we talk a lot about how the body breaks down and everything either decays or, gets worse. Is there any part of the body that is surprisingly resilient to either break down, decay?
Yeah, the nervous system, basically, once it forms, that's mostly it. Mm-hmm. The nerves that you were born with, basically, are the ones that you still have. And some of them will regenerate. Peripheral nerves will regenerate, but the central nerves, they'll change their connections and do some, that's how memories and how you learn music and things like that are formed. But for the most part, that's pretty resilient.
Yeah.
That's why we have a blood-brain barrier, too, is because it's so precious in there, the environment is, that you don't want just every Tom, Dick, and Harry being able to invade the neighborhood of the central nervous system. So there are only certain drugs that can get past there, certain cells that can get past there, et cetera. Now, for the first part, I think we've answered this question before. You can reject certain metals. You can be allergic to them.
Yep.
I was skeptical that you could be allergic to titanium, but then we found literature that showed that there is a very small subset of people that can't have titanium implants because they're actually allergic to them. One of the first weird medicine we ever did, Danny Ross showed us a rash on his abdomen that was right where the peg from his genes were, and we diagnosed him with a nickel allergy.
Right on.
And those are really easy. You just put, don't wear jeans that have those kinds of studs, or you can paint fingernail polish over those, or you can put a Band-Aid over the stud or whatever where it comes in contact with your skin. So that's interesting, but it is kind of different than the way that we reject hearts and stuff. Hearts and kidneys have proteins on them that say, this is me, I'm friend. We have a friend and foe system. And so those proteins say friend, 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 friend. Now, when the body misinterprets those signals, then you have an autoimmune disorder. That's where the immune system attacks its own body cells. Rheumatoid arthritis is a good example of that, where the killer cells that are supposed to be destroying foreign bodies in your system misrecognize cartilage proteins as being foe, and so they will attack them. And so when you put a heart in somebody, it's just got all these foe, I'm foreign, I need to be destroyed type proteins on them, and so the body's immune system will go and try to just kill it. So you have to give those people medications to just suppress those cells. Of course, when you do that, they do serve a real purpose. And when you suppress those cells, you run the risk of other problems. And so there are people who are on certain anti-rejection drugs that are at increased risk for certain infections or for certain neoplasms because the body's cells that are supposed to be killing those things are now being told to shut up. So, but anyway, very interesting. Let's do this one.
Can any part of the human body regenerate itself?
Yeah.
Bye, Casey.
She's not here. Genius. No, yes, of course. If I cut off if I just yank off someone's toenails, they'll regenerate. Peripheral nerves, the ones in your fingers and those kinds of things, if you damage those, if you give the body the right environment, those can regenerate.
Skin.
Yeah, skin. Yeah, good one.
Muscle.
Good one.
Muscle.
A lot of times, though, if you cut too deep into the skin, the way it regenerates with the scar, though, so it's not true regeneration.
Yeah, that's true.
But
if it's a kind of superficial,
the liver,
as long as you're healthy.
The liver's the best one I can think of. If you cut out a big chunk of your liver, it'll just grow back.
Yeah.
So, but I think Stacy's question is a good one. Why can chameleons regenerate their arms and we can't? And when we figure that one out, we will have made a real step forward in medicine. Anyway. All right, Dr. Scott, let's see here before we get out of here. We can take a couple more calls, I think. And do you have anything from the waiting room?
Nope, we're good over here.
All right, then let's do, how about this one? Let's see what this is. It just says recognized in public. We may have done this
Hey,
before.
Dr. Steve, everybody else there, how's everybody doing?
Good. Hey, thanks,
Super
man.
great,
How are
man.
you doing? Hope
Fantastic.
Good.
Great to hear.
Okay.
All right, I have a couple of questions that I haven't heard addressed in a long time, if they've been addressed.
Okay.
I know probably the second part, yes. The first one is for Dr. Steve or Dr. Scott and anyone else. Have you been recognized at your practice? If you had a patient walk in, sit
Yes.
down, and say, hey, aren't you Dr. Steve of Weird Medicine fame? And if so, do you have an experience with that? As much as you can tell,
Yeah, that's a tough one. You have to be careful. But I did have this happen a couple of times. And one, I'm giving a very sort of serious talk about, goals of care and things like that. And let's say an advanced illness. And the person turned to me and said, do you know Anthony Cumia? And I'm like, I don't know what you're talking about. And he said, yes, you do. I recognize your voice. Mm-hmm. And this was early on. Mm-hmm. And that was cool. And then we all kind of bonded over that over the long term. But it was an interesting moment. Mm-hmm. And anyone who was an Opie and Anthony fan for a long time, if they listened for a long time, particularly after the WNEW days, then they would most of the time they'd have a clue who I was. If they said, I recognize your voice. Do I know you from somewhere? I say, are you an Opie and Anthony fan? And then if they say yes, then I'll say, well, yeah, you probably heard my voice. That may be what it is. Tacy got mad. She gets mad every time I get recognized in public. Mm-hmm. We were in line to get into a plane in
Hawaii.
Hawaii. Yeah,
Hawaii.
I've told this story. Yeah.
I remember that.
And I was just saying, I wonder, they were talking about you could only have 3 ounces of fluid. And I remember I said, I wonder how much fluid you can have in a baby bottle, if you got a baby. And this guy turned around and he said, I knew that was you as soon as I heard you say the word fluid.
That's funny.
That's funny. Now, Dr. Scott gets recognized all the time, but that's because he tells everyone.
Well, almost
everyone.
Almost everyone. Hey, we did have it. Remember how many years ago we opened the dud of a beer store? And remember the guy that set us up with our credit card machine said that he would connect us with a guy in Bristol.
Yeah.
And the guy in Bristol owned a brewery, and the guy in brewery didn't know who he was talking about. Then he started going, wait a minute, who are you talking about?
And we were talking about P.A. John.
Yeah.
And he was like, wait a minute. John so-and-so is P.A. John from Weird Medicine?
Yeah.
We were like, yes. And he's like, oh, now it all makes sense.
Well, yeah. And then he goes, and wait a minute, but doctor, he goes, wait a minute, you're setting up this credit card machine for these 2 guys in Kingsport.
Right.
Dr. Steve and Dr. Scott? And the guy's like, yes, why? He goes, dude, those are guys for weird medicine. Of course, and the credit card guy didn't know.
Yeah, we ended up being buddies with him. Yeah, old Ken Moniak. He's been on the show.
Moniak's been on the show.
Is he still got his place?
Out of the beer brewing business.
Is he?
Yeah.
That's too bad. He made good beer.
He made very good beer. Yeah, he's no longer doing it, but and they're trying to sell that building now.
Oh, is that right?
Yeah. I hate it.
We did a comedy.
Just COVID just wiped him out too.
We did a comedy event there and all kinds of stuff. I enjoyed Ken a lot. Okay. So this guy has a two-part question, I think.
And second question is a pretty general weird medicine classic annals question.
Excellent.
How can I explain to my wife why my hand is in my
Okay,
pants?
number one. Okay, you can't. Before I hear any more, good, you can't. Okay, next question. Oh, I'm sorry.
How can I explain to my wife why my hand is in my pants? And I tell her, my balls are itchy. I'm doing the old pinching and rolling, the old Al Bundy with the hand on my pants.
Yeah, just tell her this.
I love to masturbate. I love to masturbate.
All right. Sorry.
And she said, why are your balls always itchy? Why are you always doing that?
Yeah, if she had balls, she would know.
And I don't have a good enough answer other than they just are.
Yeah. So the scrotum, women don't understand this part of male anatomy because their gonads are inside their body, because they can exist at body temperature and make eggs. Apparently, we can't make sperm if our testicles are at body temperature. They've got to be exactly 3 degrees below, which means that now instead of them being inside our body, they got to hang outside our body, just ripe for somebody to kick us in them, and they're in this sort of thin sac made out of skin and this sort of membranous tissue that lines it called peritoneum. It's an extension of peritoneum, which is the lining of the abdomen. And so because we have that sac lying outside of our skin, and it lies between two things which we call thighs, which in most of us are bigger than they should be. There's not a lot of air getting in there.
No.
And there's sweat and there's air, and sweat and air cause an itchy environment, and your balls are going to be itchy. Now, I never have my hands down my pants. My balls, or my scrotum never itches, but there are guys that do. Maybe you have a mild fungal infection in that area, and you may think about getting some fresh balls, which is tapioca powder. And if that doesn't do it, try treating your nuts with an over-the-counter antifungal, a jock itch, antifungal for a while, and then putting the fresh balls on.
A spa day for your nuts.
Yep. And then try a spa day for your nuts.
Spa day for your
whatever
nuts.
that is. Dr. Scott thought this one out. But anyway,
Yes.
but I think that's what it is. You got anything on that?
No, I agree with you 100%.
Yeah.
Yeah.
That's all you can tell her. Just say, listen, this is how our species procreates. It's
tell her your fingertips are cold and your testicles are warm. So it's
but your armpits are warm though too. So you can just do that.
But that'd be weird if you put your hands in the armpits.
I still just think.
I love to masturbate. I love to masturbate.
Yeah, just don't tell her you
That's
think
the
you have,
correct
just don't
answer.
tell her. Yeah, just don't tell her you think you have a fungal infection down there.
Well, no. No, I'm telling him.
No, I know.
But if you want to, now it's become a habit. But if your balls really are itchy all the time, if your scrotum, it's not your balls, it's your scrotum is actually itchy all the time, you might, there are a couple of things you could do about it. And I enumerated those, no reason to go into them again. If you didn't hear it, this is an audio podcast. Just rewind. All right, let's see here.
Hey, I've just got something to say about the comment that was made earlier about having no breasts and how someone shared that was a very personal thing. Just like to talk about that a little bit because not all men like big breasts. Thank you.
Yeah, right. No, what he's talking about is P.A. Lydia, and I'm going to keep that for the next time she's here because that is true. You know, there's somebody for everybody. And I'm glad that there are guys that like women that don't have large pendulous breasts because it's just less competition for me. That's it. Scott's not even listening. He's over there typing.
Yeah, I'm talking to Kush.
Okay.
Sean.
All right. Let's see.
Hey, Dr. Steve and crew.
Hey.
I wanted to ask you about, at the end of one of your last episodes, you said you were going to talk about stage fright and urinating for men.
We did this one last week.
Yep.
Okay, go listen to last week's show. The answer was there. It was we were talking about shy bladder.
Quick little question about cold sores.
Yep.
I never get them in the summertime. I mean, it's getting winter now. I've had 3 of them so far
That's
this year.
why they call them cold sores, but
And
it is a bit of a misnomer.
what causes a cold sore, and what's the best way to treat a cold sore?
Well, so there's cold sores and then there's cold sores. Certain cold sores are caused by herpes simplex virus. And herpes simplex virus, number 1, loves to live on the human face, particularly near the mouth. And that's just where it likes to live. And yes, can you give someone a blowjob or perform other sort of oral treats on them and transmit it? Yes, you can, but it doesn't like to live there. And it will often cause a much less severe syndrome, although not always. Now, people will say, well, herpes simplex virus is the good one. Herpes simplex 2 being the genital one is the bad one. Not true. The one that causes herpes encephalitis is almost universally herpes simplex 1, and that's an infection of the brain. So, that's rare, but when you see it, it's almost always herpes simplex 1. So even though herpes simplex 2, the jungle region version of herpes causes us more lifestyle issues. The herpes simplex 1 is the worst one. Now, some people get a thing called cheilitis in the winter, and that is where the corners of their mouth will crack and it'll get sort of granulation tissue there, and they will call that a cold sore. And that it is a cold sore, but it's not the same thing. So the ones that you're having may be actually related to cold weather. Now, is it possible that some people get herpes cold sores in the winter because cold air is, more stressful? Yeah, that's possible because we tend to get more herpes outbreaks during periods of stress. But I just think we're talking about 2 different things. And one is related to environmental changes in the skin due to cold weather and drier air. And then the other one is just, it's herpes. All right. What else you got? He's checked out.
Yeah, so wrap it up, baby.
So I'm just going to
wrap it up.
All right. Well, thanks. Always go to Dr. Scott when he's actually here in the studio, even when he is here, sometimes not here. Thanks to everyone who's made this show happen over the years. Thanks to everybody in the waiting room, particularly. Let's see who we got. Amy, talk like a hick to you, whose birthday it is today.
Yep, 55, double deuce.
Sean P., who I'll be hanging out with in Rochester, New York, February 3rd at DabbleCon. Get your tickets now at WATPlive.com. And I think I'm just going to get to go to this one and just sit and hang out and not actually have to work. So I'm looking forward to that. Amanda Davidson will be there as well. And I think we are sitting with Cardiff Electric's wife, although don't want to blow up any secrets or anything about the event, but that's all I'm saying. So we will have a fun time at that, even if nobody shows up. So, but if you want to hang out with us and, drinks around me, at least 1 or 2, if you're not sober, if you are, hearty handshake instead. Check us out at WATPlive.com. Many thanks to our listeners. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. And hello, Holly and Steve. There's your shout out. So, Merry Christmas.